All right. Hello, hello. My name is Dr. Mandy, and I'm here with two wonderful patients of mine. I'm here with Jill and Sam, and we are here to talk about something a little bit different. We're going to talk about fertility because all three of us are pregnant. So we're going to talk about, struggles in fertility and, what kind of things that can help, and dive a little bit into some bladder issues as well, maybe how that might be contributed to it. So I'm going to first introduce my guests here. We have Jill. So Jill, why don't you go ahead and briefly introduce yourself to everyone about who you are, where you're from, and anything you want to share.
Okay, great. Thanks for having me here, Dr. Mandy. My name is Jill, and I am in Ontario, Canada. And I came to Dr. Mandy last year because I was suffering horribly from interstitial cystitis. I had a lot of pain in my bladder. Pretty much everything I was eating was giving me pain. It was a really scary time for me. I also was hoping to get pregnant, and I knew that there was no way I was going to get pregnant if I was having all of this pain from what we found out later was oxalates, but from the interstitial cystitis. So I worked with Dr. Mandy, and it was a difficult journey, and I'm still feeling like I'm on that journey. But always in the back of my mind, and I made sure to tell her that like pregnancy was my ultimate goal, along with putting my IC into remission. So I worked with Dr. Mandy for a couple of months, and lo and behold, I came back to Canada, and in May, I had a miscarriage. Like I had a natural pregnancy, and then I had a miscarriage because I was feeling so much better under Dr. Mandy's regime. Like I was like the healthiest I've ever been. There's no doubt. I lost weight. My skin was beautiful. I had amazing, like the pain was basically null. Like I didn't have really any. And I'd had this natural miscarriage, and I was really upset about it. But then I thought to myself, wait, I didn't even try to get pregnant, and I had a natural miscarriage. And then I had talked to Dr. Mandy, and I thought, okay, maybe I'm going to go do IVF, because I also had embryos from my previous child. I did IVF. And then I started doing some fasting because Dr. Mandy was like, hey, do some water fasting. And I went kind of crazy. I did a lot of fasting in that month. And lo and behold, in June, I got another pregnancy test that was positive. Yeah. So I was like, I didn't tell Dr. Mandy initially because I was really nervous I was going to have another miscarriage. And then 8 weeks went by, and she emailed me, and she's like, how's it going? And I was like, I'm pregnant again. So luckily it's all worked out. So far, the first trimester went really well. And Dr. Mandy's been really wonderful. She's been communicating with me, helping me out. And now I think I'm going to get some Vicon for the pregnancy as well. And so obviously I'll go into more details when we get into the full discussion.
That's an amazing story. My gosh, I didn't know the fasting was when you got pregnant. That's new. I didn't know this. So,
Yeah.
wow, like that's crazy. I'm like floored. I love fasting. I mean, I feel like because it regenerates stem cells, it's so healing. So wow. Okay.
Yeah.
So, Sam, go ahead and introduce yourself.
Yes, my name is Sam, and I have one son that I had back in 2021. And then after about around 14 months, we actually found out that we were pregnant when he was 14 months old, and also had a miscarriage. And we weren't planning on getting pregnant, it just kind of happened. But then after that miscarriage, I like really had it in my heart that I wanted to have another child. So I started on that journey of natural fertility. All along the way, I was also dealing with not bladder pain, but more, I would say, urgency and frequency. So through my postpartum, I was drinking pretty much every day, trying to boost my milk supply, drinking a lot of spinach and strawberry smoothies with almond milk. And I was drinking raw cacao in between meals and having sweet potato fries at dinner. And so I was eating very high oxalate foods. And I really believe that was a huge contributor, along with the fact that I did have a pretty long pushing phase with my son, probably pushed for like 3 hours, did like an all natural home birth. And I think just a combination of a little bit of that pelvic floor dysfunction from postpartum, and then all the oxalates I was taking in contributed to just that nagging feeling of always feeling like I had to urinate, even though I really didn't. So those are my main symptoms that I was experiencing, but also, like I said, along the way, really wanting to get pregnant again. And so thankfully, the journey wasn't that long. Probably it took us about 7, 8 attempts, but it wasn't until I started working with you, Dr. Mandy, and a couple months in of like really dialing in and understanding how oxalates were affecting me, dialing in, and looking at my hair mineral analysis and how I had copper toxicity. I was low in iodine. My tests came back that I still had mold in my system, which I knew about the mold, but I didn't realize it was still a factor. And also glyphosate. So we just added in some binders, chlorella, zeolite. I'm actually still taking chlorella because it's safe to take through pregnancy as a natural binder. And of course, it has so many micronutrients in it. So, and then that combined with going low oxalate and doing pelvic floor therapy, I have felt relief in some of my symptoms. Definitely not at a zero yet, but considering I'm pregnant and I already have added pressure on my bladder and all of the hormones and all of the things, I'm really not feeling any increase in symptoms. So that's been a huge godsend. And then some things along the way that really helped me too were adding in the glutathione spray that you recommended, evening primrose oil. So I think just dialing in a few things, I just needed a few tweaks and to really clear out the toxins I had. And then you also had said, well, what about your husband? Have you ever had his semen tested? And I hadn't thought about doing that yet because we've been trying for less than a year. But based on your recommendation, we did have it tested and then found that he had leukocytes in his semen, which is like a prostate infection essentially. And he did a month of antibiotics, and it was like that next month that we got pregnant. So it was just kind of a combination of working on both of ourselves and our fertility, and just, of course, the right timing that everything fell into place. And so now I'm into my 6 month of pregnancy.
Amazing. So, the men are overlooked, absolutely. So my story is, and I'm older than both of you. I got pregnant at 45. I'm 46 now, so I'm an older mom, and I never thought I was gonna get pregnant and have a kid this old because my first I had at 29, and I rushed to have that because everyone was telling me you have to have the first one before 30, have the first before 30, and they were scaring me. My family was scaring me. And I got married. I think I rushed the marriage and everything too. I'm divorced now, second marriage. My husband's 50. So we're older parents. However, he was a big factor in this, a big factor as well. And I wasn't getting pregnant. I wasn't even miscarrying. I wasn't even getting pregnant, which is very unusual. I mean, I know I'm older, but when I went and got my eggs evaluated, we did the AMH and everything. I was told I was really good. My AMH was very high for my age. My egg quality likely was okay too. We found out Terry was the main problem. And so we did decide to do the IVF because we didn't want to wait. I don't want to be 50 and have a baby. So we didn't want to wait. So we did do the IVF, but I had to spend almost a year on Terry to get him fixed. And I have sperm analysis before and afters to prove it. And I have the little images of the sperm that we did, the yo sperm at home. And you can see his concentration, his motility, the just the shape of the sperm were bad, and I think with Terry the thing was he was on testosterone therapy for over 10 years, and no one knew what was going on with the root cause of Terry's root cause was iron overload, and a lot of people didn't know this. He had iron overload, and he actually, let me change my view here. Actually, he oops, sorry, let me go back to my speaker. I'll go get the gallery. I'll keep the gallery. Yeah, he had very high iron. No one really knew. I started diving into what was going on with him, and his liver enzymes were bad. His iron was high. His ferritin was high. That testosterone stuff that these guys take, it can kill them. It absolutely can kill them. Doctors don't tell you this, but when a guy in their 30s decides to go on testosterone, they have to understand the implications of this. What is the root cause of your low testosterone? Get to that, because you take those shots, you're killing your liver, you're increasing your iron, you're causing iron overload. You literally can kill yourself because of all that oxidative stress. And testosterone causes infertility in men. A lot of people don't know that. And so we got him lots of testosterone. We did everything you guys were doing, the binders, strict diet. You should have seen me. I had a chart. I was putting him on all these exercise regimens. I was like, okay, today you got to do this. He was icing his testicles. I don't know if you know you're supposed to do that. He was
No.
icing his testicles. He hated me for that. And we were really, really doing it. And I said, we are not doing this IVF until you are ready because it's way too expensive for us to waste. And we got him where he needed to be, and boom, first transfer worked for us. So we're really blessed and thankful. So, I mean, everyone has their story. I'm so glad that you guys were able to conceive naturally though, because it is ideal to do that, and Jill, your story is amazing too. I want to hear a little bit more about if you can talk about your infertility journey before you met me, because I know you have a pretty, and you can tell us how old you are, just so everyone, knows our age. Go ahead.
Okay, so I'm 43 and I got pregnant naturally at 43. And that's pretty amazing because everybody was telling me that it was never going to happen for me. But because of the work I was doing with Dr. Mandy, my health was getting so good. My whole life was changing. And I thought to myself, if I can't get pregnant like this, then something is seriously wrong, because I was more healthy like now, like at 43 than I was at 30. And I thought, like, one of the reasons, so we'll go back in time. I have two children. I have two sons. One is 3 and one is 6. I got pregnant naturally while using Clomid, but there was no direction from a fertility clinic. I just took it to get pregnant when I was 36. It took me a year. And then I had my baby at 37. There was no issues. Everything was fine. And then I started to try right away again, because I was getting up there in age. I wanted to have babies close together. And then I started miscarrying constantly. And I ended up having 4 miscarriages within a period of, I think, about a year. And so, yeah, it was really hard. Like, obviously, emotionally, it's so traumatic, but on your body physically, it's so hard too. So I went to the IVF clinic because at the time I didn't realize that if I made massive lifestyle changes and health modifications, like I hadn't met you yet, Dr. Mandy, that I probably could have conceived naturally. But again, I was so in a panic about getting pregnant again. And I believe that I made the right decision at what I had known at the time. And so I ended up doing amazing in my egg retrieval. And they were like, so how old was I? I was 38 turning 39. And they were literally like, you've done the best ever that we've ever seen for your age at the fertility clinic. And I thought, well, that's kind of weird considering I was diagnosed with poor egg quality, right? So that kind of triggered something in my mind where I went, you know what? I don't think that this is a permanent state for me. I think I can do things to change this, because if I was doing so well in the IVF, then I was like, I could probably get pregnant naturally. That's what I thought, because I wanted to have 3 children. So on the first go, I got pregnant. I had my son, and that was wonderful. He had a few health issues. He has eczema. He had some lung issues. He was hospitalized. So that was very worrisome for us. And I think all of that stress made it very difficult for me to get pregnant a third time. And so I did 2 subsequent transfers and they both failed. And I was very surprised by this. Yeah, because I had a history of being able to get pregnant, but I just couldn't keep the baby. So that's when my interstitial cystitis started to get really bad. And I started to have horrible pain. And so it was so funny because, like, I remember being at the IVF clinic in stirrups, and literally I was like, this is not how I want to have my 3rd baby. I'm going to get pregnant naturally. I was like, it's going to happen for me. I'm going to do it. I was like, I don't know how I'm going to do it, but I am. And no one believed in me because at the time I was 42. Everyone thought, you're too old, you're over the hill. But now I know chronological age and, your biological age are very different. And I believe that with your help, Dr. Mandy, I really set the clock back. Like, I feel, like I said, I was so much younger physically than I'd ever been. I was so much healthier, right? Doing all the things that you had told me to do, which we'll talk about that in detail, because I did everything. Like, I really did everything.
Yeah, you poured everything in there. And back to your thing about you mentioned something about the IVF. I'm just trying to remember. So you had the 4 miscarriages. Okay, so then you ended up having 2 more failed transfers. And I wanted to talk about that. I think a lot of people think that IVF is the solution to infertility. And then they're wildly disappointed when they go in and they spend 40, 50,000, whatever it costs, because insurance doesn't cover a lot of this. And then it doesn't work. And even when they're euploid, this is the thing that really gets me going, because it's like these doctors do not prepare people for a transfer. They just say, all right, we're going to do the retrieval, we're going to do the fertilization, we're going to test them, they're euploid, put them in, and boom, you should get pregnant. And when it doesn't happen, it makes them wonder, well, my embryo's euploid, so what's the problem? It's not the embryo, it's the woman at that point. Because if you've already had the sperm and the egg come together and they're euploid and they're obviously good quality and they're being graded, AA, whatever they're being graded, then it's not a sperm issue and an egg issue any longer, because you've already ruled all that out. It is a uterine issue. It's inflammation. It is inflammation and it's oxidative stress. I really, truly believe those are the missing links that these doctors are not addressing in these fertility clinics, and they should be. And they should be preparing women for a minimum of 6 months to prepare their uterine environment for implantation. That is so important. I mean, there's so much involved in implantation, just the blood flow and the nourishment that goes down there. You can't just stick an embryo in there and expect it's going to grow. So yeah, so I do want to dive into what you did, but I want to hear a little bit more about Sam, because Sam's the younger of the three of us. So let's hear from Sam a little bit. Oops.
Yes. So I am 33. I'm about to turn 34 this month. So I have been huge. Like, my history is pretty vast with chronic and autoimmune disorders and disease, dealing with like Lyme disease, breast implant illness, mold toxicity. And so Bell's palsy, which I had twice. Since my early 20s, I've been huge into functional medicine, biohacking, doing anything and everything. Like, I've done bee venom therapy, I do coffee enemas, like the IV drips, all the things. I will try it, the fasting. And so I've been doing a lot of this functional health medicine stuff for a really long time. So when I wasn't getting pregnant right away, I was really frustrated and not understanding why. And I think just putting added pressure onto myself, thinking I'm eating a pristine diet. Again, at the time, not realizing all of the quote unquote superfoods I was eating were actually slowly poisoning me with the oxalates. But it really wasn't until doing the personalized testing. So I hadn't done any personalized testing besides my thyroid in a really long time. It's been maybe 5-6 years. So doing the personalized tests with you, Dr. Mandy, I really believe that that is what helped move the needle. Because of course I can just throw anything at myself with all of the different biohacks and the fasting and the superfoods and supplements. But if I don't know what's happening in my own body, then I'm going to have no idea what I really need to do to balance out everything and optimize everything. And then, of course, looking at the toxins was huge too. So I really believe that it was just clearing out the residual glyphosate and mold, which another thing is, we moved the first time I was pregnant, we lived in the city. We now live in the country in farmland. Like, I'm surrounded by farms. And so I think a lot of people don't realize that glyphosate is really hard on your fertility. And that's something that was not even on my radar until we did that glyphosate test. And I'm thinking, I don't eat wheat, I eat all organic. Our water is completely reverse osmosis and filtered. So where is this glyphosate coming from? But I think it's just in the water runoff from our well water, in the air. We breathe it in on our walks. Like, I'm just surrounded by farmland. So I think that's something too, that really dialing in and detoxing that in particular made a huge difference. Like, I got glycine and fulvic acid, humic acid, all of those things to specifically get rid of the glyphosate. And I think that along with those personalized tests, that's what really moved the needle for me.
Sam, did your husband make some significant changes as well? I know you had to put him on the medication, but has he made changes as well?
Oh yeah, I had him on CQ10, Makaru, ashwagandha. He was taking like a multivitamin. Basically, he didn't even know what he was taking. I would just say, here's your pills, and he would take them with dinner. And so he's a trooper. He is under a lot of high stress. So I think that probably impacts things. And along with the glyphosate, but he does eat a fairly clean diet because he just eats whatever I feed him, and I only buy whole foods in the house. So I think it was just a combination of filling in those micronutrients for him and then optimizing his sperm quality through those different supplements, along with, of course, getting rid of the sperm infection. And so that took probably about 6 months, I would say, that we really worked on dialing in all of his supplements. And then, of course, the last thing was the antibiotics when we found the leukocytes. And of course, that I know made a huge difference too.
It does. Terry also had that as well. So we had to put him on the antibiotic for the prostate infection for about 30 days. That's usually what it takes for guys. They usually take the 30-day course, but ozone is really good for men as well, rectal ozone for prostate infections as well. I actually learned that recently because they're so close to each other, so they should do the rectal ozone. That's a great story. And you're younger, so that's a good point. I mean, age can play a role for sure, but you can still be young and have infertility issues, and you have multiple things happening. You have the autoimmune, but then you also had your husband, and the timing was right. As you were lowering your inflammation, he was doing his, and boom, the egg. I mean, because obviously egg quality and quantity is better when you're younger, so we have other challenges in our 40s. Jill, I think you also had, I think you didn't test your husband, did you?
No, we didn't test him, but we figured through, process of elimination that he might have an underlying infection. So I put him on antibiotics, the same one I was taking when we were in the States, simply because the Gen X testing literally was the best thing ever. Because I don't know if you recall, Dr. Manton, but I was doing everything. Like I was doing all of the things that you had recommended. An elimination diet. I was taking all of the supplements. I was exercising. I was taking thyroid meds, all this sort of stuff. I was doing everything. And I still had this burning pain. And so you were like, I think you have an underlying infection that has not been diagnosed. And I was like, I agree. I think I do. So I did the Gen X testing and it came back positive. I don't know if you remember that. It was like really tiny.
The microgen?
Yeah.
Yeah.
Yeah. Micro. Sorry. And then so I did that, and I remember I felt it was like the world had opened up. I was like, yes, I feel fantastic again. And nobody had caught that I had any sort of infection, right? So I believe that the last IVF transfer that I did, which happened last July in 2023, I had that infection, and I was carrying it. And so my husband got it too. And so I took the medication and I felt phenomenal. And I said, you know what? I think you're going to have this. So I did the testing twice to rule out anything else. So I did it the first time it was E. coli positive, and then I took the antibiotics and everything had gone away. And then I got him medication. And I honestly think that made such a big difference. And so the elimination diet was really tricky for me, but I managed to do it. So no dairy, no gluten, no sugar, no processed foods. And then everything I started to eat was grass-fed, organic, everything. Like I became very diligent about the whole thing. Coffee was a big deal for me because I tested high for mold, specifically with coffee beans. And so I had to switch to decaf, Swiss organic processed coffee, which was kind of life-changing for me because I'm really bothered by caffeine and all of those issues of my bladder went away. And then I started weight training. I started walking 40 minutes a day. I started getting daylight sunshine in the morning, and then at night I wouldn't wear sunglasses, so I would get the UV rays. And I was like in Florida at the time, so you get a lot of sunshine, right? I really made a point of doing that. I started doing ozone therapy, like the injection ozone therapy. And then I was fasting because you told me fast once a week, 24 hours. So I was doing that.
People don't understand that your mitochondria are pretty much dictating everything that your body does. And I think that's another area of medicine that's very much missing because a lot of the medications that doctors prescribe are mitochondrial toxins. And so in the process of trying to help you resolve whatever, let's say it's cardiovascular, by diabetes, or even certain antibiotics, you're actually poisoning your mitochondria. So all the things you're doing between the red light therapy, the ozone, the supplements that support the citric acid cycle, which was in the Vicon, your minerals, the exercise, don't underestimate that, weight training, boosting your growth hormone levels, which are really important for egg quality. Peptides, I guess, didn't come into the picture for either of you two. Peptides.
But I did do the spray. What's that spray?
The glutathione.
Yeah, I was doing that spray.
And I think you did that too, Sam, right?
Yeah. Yep. I was doing the transdermal spray and I was doing drip IVs.
Yeah. Yeah. Because we found that oxidative stress was a big deal for you. It's amazing how oxidative stress can impact younger people, even at Sam's age, because oxidative stress levels and glutathione levels don't normally start to really tank until after you're 40. And so obviously for you, you were younger. I really do agree with you, Sam, that a lot of that has to do probably with the glyphosate that you're around and all the mold toxicity that was just really causing you to age faster.
Exactly.
Yeah.
Yeah, absolutely.
Sam, did you do anything else as far as interventions that was you want to share with everybody?
Yeah, I'm trying to think. I mean, just like Jill, I was literally doing everything. Like I went all in on the protocol. And like I said, I already was living a pretty healthy lifestyle. So, like the red light therapy, walking 2 to 3 miles a day, getting sunshine and grounding, drinking mineralized water, and like really prioritizing my minerals in general, and then already eating all organic, locally produced food was something I was already doing. So it was like the lifestyle was already there. It was just the tweaking that I needed. I also added in the last month a fertility herbal tonic by Milk Moon. And I believe, I mean, that along with that month, I had added in the evening primrose oil that you recommended, which I had not been doing prior. And I think that both of those things, along with the fact that I was finally tracking my temperature every morning and checking ovulation and really dialing in, okay, when is my actual day of ovulation? I think that in the beginning, I was just missing the mark there and just going off the apps, but really not in tune with my body. So it was really doing those internal checks myself to understand what day I was actually ovulating, along with everything else that I was already doing. I think that really made the difference. And I was starting to get to the point where I'm like, oh, maybe this isn't going to happen. And it was also kind of finally that month that I like just released pressure on myself. And I think that just releasing the mental pressure also helped. So it's just a combination. It was like finally I found that sweet spot of everything that we were adding in and doing in the protocol. And then the iodine drops as well. I didn't realize that low iodine, which I had, contributed with was a factor with low fertility. So I think adding that in also made a huge difference.
Yeah, and I think Jill, for you, getting rid of the stress of conceiving was helpful because, and I do remember there was a point where Jill had the miscarriage. She had one or two back to back. One, okay. And I remember she messaged me and we got on a console and I said, hey, you got that frozen embryo? You might want to go ahead and put that in there. Because I was being cognizant of her age and I didn't want her to, continue to suffer, go through all this and because it really does wear on you. And so that's when she actually I remember she finally said, all right, I'm gonna do that. And it was that decision that she made, I truly believe with everything else you were doing is you just needed to get rid of that stress of trying naturally and be okay with doing the IVF. And then you got pregnant right after that, right?
True.
DHA is actually documented to help egg quality. And I think 25 milligrams is roughly around what a lot of people are recommending, but some doctors also say that it can hurt fertility. So it's one of those trial and error things. We did all that too. I honestly think with my situation, I think Terry, excuse me, was the missing link with his iron overload because I wasn't getting pregnant. That was my big thing was when I realized I'm not even getting pregnant. And my first two, I got pregnant first try. So, excuse me. So that's when I realized something else is going on. It's not me. It's definitely got to be something else because I'm not miscarrying. I thought if I was miscarrying, then I know it would have been an egg issue, but it wasn't miscarrying. So then that's when I realized, and we did the right test on Terry because he also did have inflammation in the prostate as well. But that iron overload, man, that can really kill fertility because that iron is such a source of oxidative stress. So we had to also with him, we also had to do phlebotomy. So he still does phlebotomy because he has iron overload genetically. So he has to go in and give blood. And if he doesn't give blood at least every 4 to 6 months, his iron starts to creep up. And we know because he starts having chronic fatigue, he starts having like spider veins on his leg. It can actually damage his heart. So, it's an area that a lot of people are just not understanding. I think when somebody goes into fertility treatments, they absolutely need to be treating their husbands at the same time as they're treating themselves. I think it's such a mistake that girls and women blame themselves for infertility and they always think it's just them. It's just me. It's me and me. and they just forget to that, oh, there's takes two to tango. It's 50-50 here, my friends. I know men have millions of sperm, that's fine, but you'd be surprised when you do sperm testing on guys, how like young guys, their sperm quality, their morphology, their concentration, they have the DFI, which is in DNA fragmentation, which he had too. I mean, if you have all of that, that sperm is not healthy enough to produce a baby. Doesn't matter how good your eggs are, and it's just, I don't understand why they constantly blame women for the infertility, where it could be men. And now we have other issues that we have to worry about too with infertility. Like, I'm not going to say it out loud, but shots that people are taking, which is just a whole nother topic of conversation. And I don't think any of us did that. No, no, no.
One other thing that I did,
Yeah.
when I had the infection and I took antibiotics, you also told me to take boric acid and vaginal probiotics. And I feel like that made a huge difference because I suddenly was making like an environment very receptive, right? And so I did like 2 bouts of it, and I remember being like, this makes me feel a lot better. I had never even heard of boric acid before. Can you believe that? Like, I have ICD and I never had used boric acid before.
Yeah, and now boric acid's great, but I think for you it'd be great too because you're when you're in your 40s. But for like someone like Sam, I'm probably didn't probably don't know this because I haven't talked about it yet with you. But vaginal vitamin C is better for the younger girls. So now we're doing vaginal vitamin C for the under 40 population, the menstruating, population, and then over 40 when they get closer to perimenopause, it's the boric acid. So yeah, that's right, because you need that acidic environment for the lactobacilli. I mean, everything has to be, if there's infections in the vagina, the sperm aren't going to survive. They're not going to survive to get to where they need to get. And the same thing with guys' prostate. If the guy's prostate is full of inflammation, the sperm are just not going to be viable enough to be able to get to their destination. So let's dive into one more topic here. Let's talk about what are you currently doing during your pregnancy to have a healthy pregnancy. So Sam, go ahead and talk about what you're currently doing.
So what I'm currently doing is for my bladder, I'm taking D-mannose, 1 scoop every night, just as preventative for UTIs. And then I'm also actually doing the probiotic suppositories still. Seed recently came out with one, a company that's really well known for their internal, like oral probiotics. I'm taking the vaginal one that they just came out with because it has a lot of different strains of the cryptis something. I know that one's really important.
Not Lactobacillus crispus?
Yes.
Okay.
Yep. So it has a couple different variations of the strains of that. So those are the 2 things I'm doing for my bladder health, along with I'm still seeing a pelvic floor therapist, just to ensure that everything's where it needs to be. And I'll also start seeing a chiropractor in a couple of weeks, my 3rd trimester, because I actually plan on doing another home birth again. I initially wasn't going to, but I changed my mind. And so I want everything to be in tip-top shape. And then I'm actually still doing like twice a week, just taking CQ10. And then I'm also, because I actually want to have a 3rd. So I plan on, wanting to keep my eggs as healthy as possible, even during the pregnancy, along with vitamin B9. And then, of course, my prenatal. And then I'm also doing an ALA supplement, specifically like a higher dose. And the low dose aspirin, like the 81 milligram aspirin, a couple times a week. So those are the things I'm doing just to keep inflammation down. I'm doing cod liver oil. And then of course, just eating like a really high protein diet. So I've really overemphasized in my first pregnancy. I think it was more carb heavy, even though it was like the good carbs, I was still just eating too many carbs. So now really emphasizing very high quality, like Greek yogurt and cottage cheese, and of course, locally sourced meat. And I feel good. I mean, I still have some of that nausea, but that along with adding in electrolytes every day and minerals. And then my husband, he is still taking CQ10 and things like shilajit, ashwagandha, maca root, because again, we do want to get pregnant after this one. So just continuing to keep our sperm and egg quality up throughout this time period as well.
And I have had no cravings for bad food. So I'm pretty sure this is a good because I have had not one. Like chocolate, I'm like, I don't even want it. Ice cream, I don't want any of it. The only thing I really had was like a crazy obsession with tomatoes and peaches. I'm really lucky though during this pregnancy, all the ice cream flares are gone. I have no problem.
Well, that's likely due to histamine, and there's a really simple explanation for this. Diamine oxidase levels are very, very high right now when you're pregnant. So, and I think they increase as you progress through the pregnancy. So you should enjoy this high diamine oxidase. That's also because you have higher levels of estrogen too. The downside of us being pregnant right now is a couple of things. We're likely to end up postpartum copper toxic. So we're gonna have to address that. We're gonna see our estrogen levels plummet. And as that's happening, there's a higher risk of things like postpartum depression. There's also higher risk of, higher risk of, what was I saying? Oh, more histamine issues. So I'm preparing myself for all of this, knowing that this can actually happen. There's also higher risk of UTIs too. So I'm having a C-section. It's planned. A couple of reasons why. I've already had two. I've never had tearing. I don't even want to experience a baby going out of my vagina at this point in time. I never had to do it. All my kids were C-sections. My first was breech. She never turned, so we had no choice. I was going to have a natural childbirth, just like you, Sam, but it didn't work for me because my daughter was stubborn and wanted to keep her head up here, didn't want to turn. Now I look back knowing she's a Virgo because she wanted to come out pretty. She didn't want to have a cone head. That's the joke I make with her. I'm like, stubbornness runs in the Virgos in my family. Then my son was a planned C-section, and then this one, because of my age, placenta, and the fact that I don't want to push a baby through that way, I'm just going to go for it. I know it's not ideal. I wish I could have a vaginal birth, but we may look into vaginal seeding. So we may look into doing, when the baby's born, to take some of the vaginal secretions and seeding the baby with it to start the microbiome off right. I'm planning on breastfeeding. As far as what I'm doing right now, I'm taking my Vicon personalized prenatal for sure, which has a ton of stuff in it. I'm doing two prenatal DHA algae oil for the brain because babies need that for brain development. I'm doing the aspirin just to prevent preeclampsia. Blood pressure is very low, keeping it right around 100 over 65. So I haven't had any issues with blood pressure. But with age, the risk of high blood pressure can happen at any point. At any point, you can wake up one day and have high blood pressure. There's no rhyme or reason behind it. So we're trying to keep that in check. I'm also doing spirulina. I haven't done the iodine, but I did just start investigating it a little bit more and might do one iodine drop every once in a while just because I think the baby needs it. I'm taking iron, ferritin supplementation. Lucky, just like you, Sam, I have prioritized protein as well, which is very unusual with my other two pregnancies. I was very, very dominant with carbs before too, and I gained a ton of weight with both of my pregnancies. And this one, I'm still gaining, but like I don't look like I have gained that much. So that's kind of weird. Like I'm gaining like I did with the other two, but I just don't look like I have. Like the other two, I look big. And I think it's because like overweight big. And I think it's because I'm weight training. Still weight training. I'm still walking. I'm still doing cardio. I'm staying active. But I really think a big part of that, just like you said, Sam, is because I'm prioritizing protein and not carbing it up as much. So I think I'm keeping my blood sugar more in check. Plus, I went into this pregnancy with really good blood sugar pathways. I didn't have any blood sugar issues. I was fasting. A1C was 5.1, C-peptide was 1.1. I was like modicum of blood sugar. So I think that one of the reasons women gain so much weight during pregnancy and make these big babies is because of insulin. So I think because my insulin levels are better, I'm not, craving as much carbs and I'm not looking overweight pregnant. Like I've gained 20 pounds, but I don't look like I have. So that's the one thing that I thought was really interesting. And then, other than that, I also am getting a new PEMF device. I can send you guys the link if you want. This one is handheld, and I'm going to bring it to the hospital with me after my C-section, and I'm getting my red light and I'm going to start shining my area down there immediately after the surgery so I can heal faster. I'm not taking zeolite. That's contraindicated during pregnancy, so I stopped that, and I've stopped any like weird things like chlorine dioxide or any of those other weird types of supplements that could hurt the baby. I am though taking what's I gonna say? DHA. I'm not doing the zeolite. I can't remember. Do you guys have baby brain? Do you guys forget stuff? Okay.
Oh yeah, all the time.
Okay. Like I just forgot what I was gonna say. Yeah. I'm just trying to think what else I'm doing. I really try to do the 2 eggs a day. I just can't do the 2 eggs a day. I'm trying to. I'm just not loving eggs right now. So I'm like, sorry, baby, you're not getting the eggs. I'm supposed to have 2 a day. I just can't do it. Um, red meat is really, oh, iron. Iron is another thing that I found was really interesting. I was deficient in iron with both of my other 2 pregnancies. I was chewing ice all the time. I had like the pica. So the fact that I'm actually eating red meat now and I actually can eat it and keep it down and I enjoy it and I'm craving it is a really good sign. So knock on wood, I will hopefully, because I do believe that my iron deficiency that I had with my pregnancy with my daughter was contributing to a lot of her anxiety that she had as a young child. Because iron deficiency is a big part of anxiety. So keep that also in mind with your nutrients with your kids, because whatever you're deficient in, you will pass on to your kids. But one really important thing you should both know, if you have a girl, which neither of you know what you're having yet.
I'm having a boy.
Oh, you're having a boy.
Yeah,
Okay. And your first is a,
boy.
oh, no wonder you want to go for 3. Try for
Yeah.
that girl.
Right.
Try for that girl. No, so, and you don't know Jill, right?
I'm not gonna find out.
You're not gonna find out. That's amazing. Oh, surprise. Really? So neutral everything, huh?
I'm doing it different this time. I've been going for
All
a
right. Nice. That's exciting. Yeah, no, we're definitely having a boy. And we're thankful we are because we got to choose, obviously, because we had 2 boys and a girl embryo, so we picked a boy for primarily for Terry because he doesn't have a son. But girls got to be careful if you have a girl because if you have copper toxicity, passing it right on to the baby. And I didn't know I did that to my daughter. And I didn't realize it until she started really expressing these anxiety symptoms as an adolescent that were very, very unusual. She even had it as a baby, actually. She had night terrors. She had lots of anxiety. She was afraid of everything. And I just kind of didn't understand what was going on. I finally did an HTMA on her. And boom, her copper levels were like off the charts. And I realized that it was my estrogen dominance that caused it. So with girls, just gotta be real careful because, and one thing I will recommend for both of you is when the babies are a little older, maybe a year old or whatever, get an HTMA on them. Get an HTMA on them, 100%, because you can stop things before they become manifest into. I wish I knew, because then she was experiencing such anxiety to the point where it's becoming debilitating. Once I started really honing in on this, and I started giving her the zeolite and the Vicon and changing up her diet, man, she's a different child now. You don't realize what you're doing. And the other thing too to keep in mind too is yeast. Yeast can be passed on through breast milk to your child. And I did that with my son because I had yeast because they had me on an antibiotic because I had an infection on my C-section. Another reason I'm bringing my red light and my PMF. So I had an infection. They put me on a really high antibiotic while I was in the hospital. And so I developed yeast infections and went through my milk. And I knew it was because I was getting the yeast on the nipples. And lo and behold, this poor little boy had massive amounts of candida in his gut. And he had the rashes, when the babies have the rashes on their bum. So there's lots of little things to keep in mind with, our little ones that we have to be careful with. So yeah. So you guys want to share anything else?
I want to say that this is my healthiest pregnancy by far. And I really understand now how important preconception health is. I was always taught that okay, as soon as you get pregnant, then you have to gear everything towards the pregnancy and really treat your body well during the pregnancy. But now I realize obviously that is true. But the preconception period, I'm having a wonderful pregnancy because I was so healthy coming into pregnancy. And, I've continued my weight training. I've continued working out. My other 2 pregnancies, I didn't work out. I did some brisk walking, but that was it. Now I'm doing full-blown weight training 4 to 5 times a week. I feel wonderful. I'm not having any issues. So I really have to give my hand to you, Dr. Mandy, because you are the reason that I'm everything that you did with me. I got pregnant 100% because of you and my discipline and my willingness to stick with the different. So.
And I'm gonna say, initially it wasn't an easy journey for you because I know there's a lot of changes you had to make that I know you struggled with initially. And we just stayed on track. And I got disciplined with you. You know, I'm like, Jill, you got to do this. You got to do this. You got to do this. Like, I don't sugarcoat things. I'm like, listen, so the choice is yours. You know, here's what you can do. You can do nothing. And Jill knew this. And she really did take the bull by the horns and really did. And kudos to you for doing that, because you are where you are. And hopefully after the pregnancy, we can get in touch and we can get that histamine under control, you know. And you know, another thing with the infections, another thing I was going to mention too is because your UTIs can increase during pregnancy. What I would do is what Sam's doing is go ahead and, you know, just take the preventative measures with the D-mannose and maybe even the probiotic that she's using to kind of prevent, you know, because the hormonal changes can cause the UTIs. And you can even shine red light down there after the baby's born. Don't do it now because it's too close to too close to the baby. But after the baby's born, you can shine red light down there to kind of stimulate, you know, your immune system down there. Oh, I forgot to mention one more thing I'm doing. The B6. That's something I didn't want to forget to say. My nausea for my first two pregnancies went on for 9 months. I had nausea the whole time, which I think really affected my ability to make better choices with my diet. And I finally came to the conclusion that I am not a good absorber of vitamin B6 through my nutrigenomics test because I have two of the mutations that are involved in B6 transport. And no wonder my alkaline phosphatase levels were always low because I have an alkaline phosphatase mutation. So I went ahead and bit the bullet, even though I'm taking 50 milligrams of P5P in my Vicon. I went ahead and did the liposomal B6 on top of all the B6 I'm taking, and I'm telling you, hands down, this made a difference. My God, within a week of taking this, my nausea disappeared. I was able to eat normally and feel normal. And I tested it out and stopped it for a week because I was like, oh, maybe it's just because I'm in my second trimester, you know, it's not the B6. So I stopped it for a week, and lo and behold, guess what started coming back? My nausea. And I was like, what, are you kidding me? And so B6 is critical. And I will say something else. If your B6 levels are low or you suspect it could be low, you are a higher risk of getting postpartum depression because you need B6 to make serotonin. So just keep that in the back of your head. You know, B6 could really save your life during and after the pregnancy. I don't think there's any downsides at all to it, to take a little bit extra because it's not in the P5P form, it's in the pyridoxine form. So you're getting both. You know what I mean? So just, you know, if you need the link, I can send it. It's just something I got online from the internet. So
Yeah, I'm actually doing that liposomal B6 as well that you recommended. And I did it for probably like a week. And I think that at the time I was just so nauseous that I couldn't do the spoonful anymore. So maybe I need to add it back into my smoothies because you reminded me I have it in the fridge. I have low grade nausea, but not anything nears what I had with my son. Same nausea through the whole 9 months with him up until I gave birth, and then it all disappeared. But it's still there, but I feel so much more in tune with my body. And I don't have the crazy food aversions like I did with him. I'm still able to maintain pretty much my normal diet again after getting through the first trimester. And that feels really good. And overall, I'm also strength training. I'm still walking every day. I feel just a lot stronger during this pregnancy, which feels incredible, knowing that that's really going to set me up for a successful postpartum. And then knowing that I want to try and get pregnant again. So I'm really just putting everything into nourishing my body as much as possible right now. And yeah, feeling amazing. And I think that all of the tweaks that we made and just understanding how my biology specifically works and what I need to tweak from those results made a world of difference for me. And so that's information I can take and really apply lifelong. So I'm really thankful for all of that information that you were able to provide.
yeah, well, this was so much fun. You know what? Let's do this again when we have our babies.
Yeah.
And we'll bring our baby. No, seriously, let's bring our babies because you're 15 weeks, right, Jill? So you're going to give birth about 10 weeks after us.
Yeah, my baby is due on my birthday.
When?
February 27th.
Oh my God, that is amazing. On your birthday?
Yeah.
That is that's a blessing.
No, right?
And Sam, when's your due date?
December 26th.
Okay. What? After Christmas?
Yeah.
Oh my, you might have a Christmas baby. You just never know.
Right. I was 2 weeks early with my first, so I'm hoping to go early again. It would be really nice.
Yeah, then we'll be around the same time because my C-section is scheduled for December 11th. But the doctors say they may push it up by a week or two, depending on where my placenta is located. Well, this was fun. Well, thank you for doing this. I really appreciate good seeing both of you, and you guys are both glowing.
Yes.
It's amazing.
Thank you. You too.
Let's stay in touch and let's definitely repeat this when we have our babies and we'll just come and have like a little a baby fest.
Yeah, perfect. That sounds
Baby.
Baby,
good.
yeah. Stay in touch, ladies, okay?
All right. Thank
All right.
you.
Thank you. Talk to you soon.
Yep.
Bye.